We're going to transition now to our panel, and you're probably, after this panel, there's not going to be quite so much on rural. We're really hammering it down this morning because that hadn't been a topic of focus up until this time. So Susan's going to give us a blitz. I'll let you introduce yourself and your panel, and thank you very much.
All right, thank you. Good morning, everybody. Almost lunchtime. I seem to always hit the spot right before lunchtime, and everybody's hungry, and you can smell the food. My name is Susan Harvey. I'm an associate professor of community health in the Department of Health, Sport, and Exercise Sciences at the University of Kansas. I am really fortunate today to be a part of this panel and to learn from people who really have their boots on the ground when it comes to implementing food as medicine in rural and frontier areas. I want to start off just having everybody that's on this panel do a quick introduction of yourselves and where you're currently located, and then we'll kind of jump into questions from there. So welcome, Carmen. I see you up on. I'm going to pivot over to you, Carmen, okay? Little inside joke there, huh?
I remember pivot from last year.
Remember that? Yes. Yeah, Carmen, tell us a little bit about yourself.
Yeah, hi, everyone. Hello from Montana, and thank you for having me virtually. I'm Carmen Byker Shanks. I'm a principal research scientist at the Gretchen Swanson Center for Nutrition, and a Montana resident because we are a remote organization. So my colleagues, Amy Yarrow and Chris Long, are in the audience. So definitely say hello to them and look forward to this panel.
All right. Thank you, Carmen. Kyle, let's hear from you.
I'm Kyle Ahlenstorf, CEO at Infinity Health in South Central Iowa, Northern Missouri. I got acquainted with Susan. I was in Northwest Kansas up until about a month and a half ago. So I got to work with the team in Hoxie to implement the food as medicine program there.
Okay. And Alice.
Hi, everybody. I'm Alice Ammerman. I'm at the University of North Carolina at Chapel Hill. Go Tar Heels. And I am the Department of Nutrition, and I also direct a Center for Health Promotion and Disease Prevention, which is a prevention research center. So I have kind of two hats related to food as medicine. I'm academic researcher, community engaged, chronic disease prevention. And then kind of as a result of all of that, I started a social venture that we call Equity Foods. I told them I wanted to be in the C-suite, so I'm the chief nutrition officer. I don't think there's too many of those. So I could talk more about that later.
All right, thank you. And I'm sorry, go Jayhawks. Carmen, I want to pivot back to you and understand your role with GusNIP and also your direct experience in really getting food as medicine up and going in those rural areas where you're from.
Great, thanks. So I've worked in food as medicine on two different levels. One is on the national level in GusNIP, and then the second is in my experience as a Montana resident living in a very rural state. So I'll start by talking about my Montana experience, and then I'll move to a little bit about GusNIP. So many of you have experienced Montana through the show Yellowstone. And I'll tell you that it is just as beautiful as the show shows and as rural, but there's a lot less drama here. So if you're ever in Montana, let me know. Anyway, so the context of my work, one of my big focuses in my career has been rural nutrition security. And many of the solutions that the communities I've worked with in Montana have coalesced around a food as medicine solution, even before food as medicine was such a cool term. And so I want to highlight two pieces of work where I helped to forge partnerships and build programs around food as medicine. One was with a food pantry and healthcare spaces in rural areas of Southwest Montana to develop the Unprocessed Pantry Project. And in that work, participants of the food pantry and in the healthcare space selected food boxes, engaged in nutrition education, worked with local healthcare to measure health outcomes, and importantly, in that project, received social support. Second, I've done a lot of work with the Flathead Nation over many years, and this has been community-based participatory research, which has been so important to understanding the assets and barriers surrounding nutrition security for tribal residents in that space in Montana. And we've developed several iterations of food as medicine solutions that have focused on healthy and sustainable diets. And I highlight those two programs because they're both in Montana, but the solutions were very locally based and community engaged, and each program looked a little bit different. And that's been really important to rural work. One thing that I've learned from my work is connecting with people in rural places to understand what's really important to them and their community. And then secondly, figuring out ways to build health and food into those conversations in a way that supports success of food as medicine. And what I found is in the nutrition security space in rural places is that without building those bridges, participants and communities have straight up told me that their life is too stressful to worry about how food impacts their health. There's so many other things that they have to worry about. And so making connections about what matters to people in rural places has been key to that work. In my current work at the Gretchen Swanson Center for Nutrition, I'm co-project director of the GUSNIP NTAE, and the NTAE provides leadership for evaluation and technical assistance for over 200 produce prescription and nutrition incentive projects nationwide. And since I'm with you virtually, I will quickly just show you, we have mapped out the site locations of different produce prescription projects here. And you can see that overlaid with, in the green is urban and in the orange is rural. The purple figures are brick and mortar clinic and farm direct sites where produce prescription operates. There is a fair amount of rural spaces where produce prescriptions operate, as you can see on this slide in the orange spaces. But what I really notice, and the focus of this convening, is that in the Midwest, there are far fewer produce prescription projects than the rest of the nation. And so one of the pieces of our work, which Chris and Amy will talk a lot about GUSNIP with you all later today and tomorrow, is to think about how to expand produce prescription to these two underserved communities and geographies, which includes rural spaces. So I look forward to talking a little bit more on this panel about the different ways in which I've worked in food as medicine.
Great. Thank you, Carmen. I love the community-based research that you're doing. Very helpful. Kyle, let's turn to you. So you have to do a lot of problem solving and just relationship building with the work that you're doing. Within working in rural and frontier areas, there's also a lot of other pockets around that region that are also very much remote. So talk to us about how you problem solve through various challenges with the different clinics and communities that you're working with, those partnerships and collaborations that you work to build to be able to bring in community members and really try to engage them with the work that you're doing.
And that I think was probably one of the things that I didn't see as the biggest challenge when we signed up for this grant. You think of food. You can get food, you can get it to the areas you need it. What we ran into was access to food and getting the fresh produce into our communities. We do have a small local grocery store, but their access and their variety of that fresh food is very limited. Quickly spoils by the time it does get there. It's been on trucks for several days by the time it arrives. So Jody, who I believe spoke yesterday, her and her team did a great job of getting those partnerships, finding those relationships to be able to not only get it in, but get it distributed quickly to those communities that we partnered with. We partnered primarily with public health and other counties, looking at different school alternatives to get that produce into homes, having it distributed at the schools is another idea that Jody has kind of brought up in our conversations this week. And finding those partnerships where you've got a captive audience, where you know it's going to make an impact and get it to the places that it needs to be, is probably the most important things we've done.
Okay, all right. That's a big challenge right there, that food access, isn't it? So Alice, tell us about the work that you're doing, some of the assets and the challenges within the communities that you've done your work and research with.
Well, I think it's been mentioned several times, the importance of culture when it comes to food, and that we can't just kind of impose our way of thinking on and eating on different cultural groups. But I think it's really important too that we recognize evidence base related to nutrition. So I mentioned this a little bit yesterday. The Mediterranean diet over and over again has been shown to have really good science behind it in terms of being a healthy diet. But a lot of people think that means you have to eat grape leaves, and it doesn't mean that. You can adapt the basic principles, which are not that different. They're healthy oils and more of them. You know, we're not doing low fat anymore, and nuts, and then the usual things that your grandmother always told you to eat: more vegetables and fruits and whole grains. We've adapted this over time because in our work with rural areas, we find that they want to eat the way they're used to eating, but with some tweaking. So we've adapted what we call the Med-South diet, which is taking the Mediterranean diet and adapting it to Southeastern taste preferences. And then just another example of how extreme this could be, I've worked with some folks in Nairobi, Kenya, and they are concerned about the increasing rates of chronic disease there. And so they asked me to go through the recipe book and make some suggestions. So I was able to say, well, one thing, they eat a lot of collard greens, and which is what we eat in North Carolina. So that was fun to see. But just by tweaking things a little bit, you can really have a strong evidence-based diet that also meets people's culture. So I just want to make sure that people don't think that the Mediterranean diet is not appropriate for other people. So then that kind of led to how do we get the food to people. So that's why I started this little scrappy company called Equity Foods, and we make a healthy frozen meal product that we source from local farmers. So I was thinking that pyramid we've seen a couple times, it kind of fits both the top and the bottom, medically tailored meals, but then we're addressing local rural economic development by sourcing from local farmers, working with local businesses and food distributors. So, but that's a way, because they're frozen, you were talking about perishable foods, it can last 2 years rather than 2 weeks or 1 week. And we worked with a lot, we're also funded with the 1115 waiver in North Carolina, and we're working with one of the pilot studies. So we've learned a lot about how to work with local organizations to get the referrals and then provide the meals to them. I questioned yesterday, too, the notion of medically tailored meals because it kind of medicalizes nutrition. I think in a lot of ways, if you use the basic principles of the Mediterranean diet and adapt it to the culture, most of those are going to be tailored enough. You don't have to do anything really fancy and extra, so a lot of people can take what they're used to eating, make some tweaks, and it'll be good for them health-wise.
Okay. How hard was it to build that relationship with the farmers? You said with the local, just getting those local ingredients, but getting that buy-in from them as well.
I just had a meeting a couple days ago with somebody with Farmer Food Share, and he's the guy that goes out and works with all the farmers, and they specialize in North Carolina food. And we're trying to use grade B or cosmetically challenged, food that's not easy to sell for the farmers. But the systems are not well in place yet, so he's trying to help us do that so that we can tell them what our needs are going to be when we produce the meals. And then they can go out and say, okay, if you've got some seconds, we can actually buy them from you. Usually these are tossed or composted. So it's a way to reduce food costs and reduce food waste while supporting the farmers.
So I'm also really curious, just as far as what do the community members in these rural communities, I've heard some perspective on my work with Kyle and Hoxie, they really embrace it. What has been everyone else's experience when the topic is brought up to them about being part of a food as medicine program, and what does it take to get that buy-in for those community members? I'll just open that up to anybody. Has that been a challenge? Has that been relatively easy? Is it a mix of in between? Does it depend?
I'm not sure we've used that term very much. I don't know if you guys have food as medicine per se.
What do you use? What's the term you use?
Just people are concerned about their health and they know they need to be eating a healthier diet, and so we try to figure out how to make that work. And for the farmers, they need more markets, they need more opportunities. So, it's addressing each of the segments where their needs are and trying to piece them together to make them work in a system.
And that's in Hoxie, we have promoted food as medicine. That's kind of the approach that we've taken to the relationships that we built. We were fortunate that we had a restaurant there in Hoxie, and she's culinarily trained, and she volunteered her time and knowledge to create these recipes for us to be diabetic friendly. And that created the opportunity to also partner with a local grocery store to get these resources. So we used our community resources to kind of build the program internally, driving that economic driver inside. So a lot of the money that we received in this grant was reinvested in our community overall.
What about, yesterday we talked a lot about like group education, group settings, social settings to bring people together for diabetic education or other health, nutrition education. What's been everybody's experience with, bringing together some of those pockets of remote areas to be able to do that type of work or engagement?
I think it's really important in rural spaces to have enough resources to do work that can be tailored to participant needs. And so in all of the food as medicine type work that I have done, it's been so essential to get creative and even though there's less participants maybe in a program, it definitely takes extra time and resources, like money or space, to make sure that the program can navigate the unique needs of rural spaces. So transportation has been an overarching theme that I've had to address, and long distances and limited public transportation opportunities, as well as the expense of owning one's own transportation, has always been something that I've had to solve within projects. And so whether that's finding multiple locations where the program can be run out of, or providing like gas money stipends, finding other participants who are willing to like pick up people or drop them off because of the more tight-knit nature of rural communities. I think the solutions have been different in every place that I've worked, but it's definitely taken a significant amount of time and effort to think through those solutions to make it work for the rural space. And post-COVID, telehealth has increased, and so working with healthcare, seeing how we can leverage telehealth has been important. But I do think having someone dedicated on a project team to just figuring out unique needs does help with project success, in terms of whether, I think your question was around like offering group education, or whether it's just picking up food or participating in the program in the other ways that the program is operating.
Okay, thanks, Carmen. Kind of one last question before we open it up for broader discussion. This morning, we heard from somebody where innovation really is demanded within these remote areas. And so I just want to open it up to all of our panelists to understand, where have you found that innovation? What are those unique assets from these communities that we can learn from and take away and maybe pick them up and put them in other areas? Alice, you want to start?
Well, one thing we did, we have funding from the National Institute of Minority Health and Health Disparities for what's called an STTR grant, Small Business Technology Transfer. They also fund SBIRs, if you've heard of that. So all of the federal funders have to set aside a certain amount of their money for that. So we started as a for-profit, even though that maybe wasn't my preference, because you have to be a for-profit to be able to get that funding. So we have a phase 2 grant with them, and we're working in blue-collar work sites, and we've taken retrofitted ice cream machines to make our bowls, our healthy frozen bowls, available at worksite settings, like in rural areas. The only thing they have to eat is the typical vending machines of chips and soda. So we figured we would play the same game and use a vending machine to make the bowls available. Now, it's not all easy street, it requires a certain plug to make it work, and sometimes they go down. But it is a way. My dream, actually, if anybody can help me solve this, is to get the vending machines to take SNAP. I've talked to everybody I can think of, and maybe you know. So anyway, I guess that's an innovation of sorts.
Love it. Kyle?
And that I think Carmen kind of talked on, having that one person that can really expedite things and get things going. And we fortunately hired that person at the right time, and she was there for us. And the innovation, the things that she did to solve the problems that we faced, made it look seamless.
I'm sorry, I can't hear the panel at all. It ended with, I didn't hear Kyle's response, and now I don't think I can hear Susan.
Oh, no.
Now I can hear it.
Okay.
Okay.
Okay. Can you hear me now?
Yes.
So just a final thoughts on you, above what you've already talked about, some of the innovation and problem solving that you've done, other assets that you've seen within the communities that have helped food as medicine to get on the ground and going and expanding and sustained with the work that you're doing.
Yeah, so I think I've only been able to have project success by working with local practitioners and families to create innovations, to leverage assets, to work with challenges. And I think my big take-home point is that each rural community is unique. So we may find some commonalities in the assets or challenges among rural communities, but a lot of my work, I've been an outsider of a rural community, and it's been really important for me to engage with people locally first, to understand the assets and the challenges, and then create the innovations. Because especially in rural places, there's this need to build trust and relationships. And on my behalf, that's taken a lot of in-person time, hours on the road, because rural places are usually really far away. Montana is 11 hours from the top of the state to the bottom in driving distance. Having conversations, listening, showing up early, staying late, all of those things build trust with communities. And then I think those conversations around what are the assets, what are the challenges come up, and then innovations are built from there. And then it's also really important to have local partners in work that can help navigate where someone working on a project or running a project goes, such as myself. So for example, when working on the Flathead, I had a local partner, Virgil Dupuis, who's always been willing to present any of the work that I've been interested in working with the community on at tribal council. And that's been really key to getting the support of the whole community. And so I just emphasize like figuring out assets and challenges that exist has to happen in partnership with people who live there and experience them, and then innovations can come next. So I think that's my big takeaway.
Great. So it's a significant takeaway. George, we'll bring it to you now to open it up for larger discussion.
You have about 10 minutes, and while you're doing that, I'm going to go check on Chef. So.
Perfect. We'll take it away. Any questions out there to start us off from this awesome panel? We should probably take a minute to thank this awesome panel first. So let's give them a round of applause. Okay. And the same framework today as earlier this morning. The whole point of being here today is to stoke conversation. So whether you have a question, a comment, or a personal experience, we want to hear it. And hopefully that'll continue dialogue. But while we're thinking about our next questions, I'm just really interested from a researcher's perspective, which I am not, but from a research perspective, and to help frame this, you all talked about rural communities aren't cookie cutter, the solutions and problems aren't the same. Earlier this morning we heard like rural is not just the same problems but not urban. So I'm just wondering, as we think about research in this work, what's the role of the lived experts on the ground in informing research, and how have you seen that in your work, or where do you think we need to go with that?
Well, certainly it's important to talk with people when you're first getting started and do some qualitative research as well to understand what some of the differences might be. And then kind of building on this notion of working with community members, if you can identify people in the community who would be the ones to administer surveys and help, because people will trust them more and they'll understand the purpose of it, and you're likely to get much better data than some outsider who people may feel suspicious about.
Anybody else on the panel have anything to add as sort of thinking about researchers and leveraging lived expertise?
Yeah, I just worked on a qualitative research study in 5 different states across the country, looking at rural food and nutrition security in partnership with Share Our Strength. And what we did was work with around 80 families and practitioners living in these 5 states around the country, and asked them policy systems and environmental solutions to rural food and nutrition security. And we asked this, of course, in less academic terms. But I think what the rural participants told us overlaps really well with what we're learning in food as medicine in rural spaces in terms of assets and challenges. And so some of the assets, well, first of all, we really wanted to get into the policy systems and environment solutions, but people really wanted to sit and talk about why rural America is amazing and why the places that they live are amazing. And so, there's as like researchers and practitioners who work with this space, it's very important that before we do any of our work, we think about like how community members want their communities to be reflected, because that felt so important in the qualitative research that we did, for people to say, hey, stop, let's not talk about solutions, because those aren't as what I want to talk about. I want to talk about why it's great to live here. And so people talked about easily being able to connect with local organizations, opportunities to use the agricultural landscape to build the local food system and the local economy, as Alice was talking about. Rural communities being really close knit to each other and willing to help each other out, and a very strong sense of self-sufficiency. And so thinking about building programs in a way that uplifts people's self-sufficiency. And people really wanted to stop and talk about those assets. And then of course they talked about the challenges, but really where the conversation was bright and bold was around assets. And so I think when we do our work, we have to come at it in food as medicine and rural spaces by talking about the communities like they want us to talk about them, not focusing on all the disparities that exist, but building these programs off of the things that make them proud to live there. And the solutions that they have, because the assets or the solutions are going to come from those assets.
I have a follow-up question to that. You were talking about self-sufficiency. One of the things that we haven't talked a lot about, or at least I haven't heard so far, is like community gardens and that concept. And I'd be just curious what you're seeing with that or hearing about that, either as a supplement or a complement or an adjunct to the farmers market. I know we were discussing locally, our farmers market for some reason is not as robust as we would hope, and I don't know why. We don't know why, but there is some active community gardening. There's a lot of interesting, obviously connective other pieces to that. But I was curious what people have to say about that.
The farmers markets can be kind of expensive too. I don't know if that's the case for you, or maybe it's just not coordinated well enough. But one thing with community gardens, the community can do a lot to support them. To just digging up the soil to get ready for a garden takes a lot of doing. And so if either the city or the county can help with that and establish space for it, that can be really helpful. There is some literature showing what a good social bonding kind of experience community gardening can be. There's different ways to do it. Some people set up separate plots and each person tends their own plot, which has some of its benefits in that people feel like they've got their own control over it. On the other hand, I've heard there's sometimes competition between people for their plots. But also it doesn't have quite the same feeling as we're coming together and doing this. We have a campus community garden at UNC that is all shared and all the proceeds go to low-wage workers. And not a lot of the workers are able to volunteer, but students and others in the community do, and they feel like that's really offering a benefit, plus all the good feeling of working together on a garden. So I think there's some evidence that gardens can provide, good quality food for people. It also kind of reawakens some of the old days of the victory gardens and things that older folks sometimes remember, where they really did that for survival. And so there's some historical memory there you can build on with that. Anybody else?
Elizabeth Corby, then Corby, sorry.
And I'm actually not being mean mom with time. I have a question. I'm determined to ask my question. We've still got plenty of time. When you're thinking about research in rural communities, and as we're talking about community gardens and farmers markets, what always comes to my mind is because of the low population density, these projects that we immediately go to, a community garden, it's the same 3 people in every small town that end up doing it. And when they age out, move away, get burned out, get in a fight with someone, and I'm not trying to be facetious, this all happens, the project ends. How do we think about that when we are evaluating these projects? Does that make sense? And I don't even know what that factor is called, but it's the factor of living in a small town where there's not enough people to do all the work. Thank you.
I think the social connectedness and the resource availability to do the work is an important piece to understand and measure in rural places, and also build programs around. I do think that people, going back to the community garden question, I do think people a lot of times go to thinking of community gardens as solutions, and that could be one part of a food system. But for places like Montana, where last week it was -50, like that just doesn't, it's not a solution year round. And so community gardens take a lot of resources and expertise. And in the study that I was referring to across 5 states with rural families and practitioners, we did get to the policy, systems, and environmental strategy solutions. And local food solutions were suggested, but when the participants were asked to rank solutions to food and nutrition security, things around employment, affordable housing, transportation, expanding awareness around social services available rose way to the top above local food solutions because of the fact that people, in order to reduce anxiety around food and nutrition security, first need to address things that come along with poverty, such as employment and housing, et cetera, in rural areas. So I just wanted to add that in there. And I also agree with you, Elizabeth, that I do think it's really important to include in our evaluations the amount of resources, the people involved that it takes to run any type of program in a rural place, because it looks really different. And that's more the implementation science piece of evaluation, and making sure that there's an infrastructure to understand what it takes to actually implement a program in a rural space, so that when programs try to scale or we all try to learn from each other, there is that piece that exists, which looks really different than in non-rural spaces.
Thank you, Carmen. I really appreciate that answer too. Just from the practicality of running these programs, things don't go narrow, straight ever. I think we can all speak to that. And so building that into your research, and I know we've been really lucky in Oklahoma with our partners at OU who've been very adaptable in their research of our program that doesn't ever like to follow a very linear pathway. So Corby, I'm going to kick it off to you, not ask question. Oh, okay. Okay, I'm going to come to y'all right after Corby, I promise.
So I'll make mine really quick, which is maybe for Kyle and Susan, because Carmen brought up what I thought was a huge topic, which is the difficulty of building trust. And we talk about that all the time, and I'm more familiar with the problem in urban communities because it's the places I've worked and talked to people about that problem. But do any of you want to give any insights into how to build trust? It's always driving 11 hours each way, showing up 2 hours earlier and staying 3 hours late. But what else in the approach of building trust in rural communities?
I guess I want to turn the table and ask you guys a question quickly. How many in the group are familiar with a community health center and FQHC? Okay, so we got a good, and I guess to answer that is, from my perspective, and especially being in a rural location, we don't have a lot of choice of where you go. So having that trust and built-in trust and year-over-year trust does make a big impact. There were people that wouldn't come to our hospital or clinic because their grandmother, their great-grandmother had an issue there. Staff has changed, physicians have changed. So that trust has to come from different angles. And that's, I guess, food as medicine was another way for us to connect with our communities. And the other thing that I've kind of heard from this group is there's so many things. There's mental health, there's medical, there's oral, there's pharmacy that impact by the food as medicine program. And that's one of the things as a community health center that we focus on. We try to be that one-stop shop for all those services. So if we can get involved in this food as medicine and make it the forefront of what we're doing to help the health of the people that we reach, a lot of the people that we're trying to reach are the people that we're already serving. They're in a difficult situation. We're trying to connect with them, and we're hoping to be the people that they trust.
Beautiful. And then Anybody on the panel want to add to that? I want to make sure we get in one more question before Elizabeth takes the cane and pulls me off the stage.
Just one quick thing from this conversation with the person who works with the farmers. Farmer's ideal would be if you could plan ahead and tell them what you're going to use so they could almost contract for that. And he said the one thing that will lose their trust completely is if you make a deal with them, if you promise you'll buy everything and then you don't buy it. So you really have to follow through.
Yeah, very important perspective. All right, Rachel?
Okay, yeah, I have more of a comment, I guess, in terms of, it's kind of a callback to, I guess, trust building and community input, and just the idea of compensation and understanding what you're asking of the community. So at our organization, we do a lot of community-based input. We're asset-based community development, and so we really lean into the community's input, but we don't do that without giving it anything in return. So a lot of our boards that we have, we actually pay our members to attend to give their input to show how much we value them. But then also in that same vein, going into the community gardening conversation, we have a farm on our premises that I think we've been having a lot of conversations about the broader implications of food insecurity and poverty and what that looks like community-wide, and thinking about, I guess education would be another example. And in our community, we had a high school dropout rate of 86% because students were dropping out to go get jobs to support their families. And so as a solution to that, we said, why don't we get students to stay in school and pay them to come work on our farm, to learn more about agriculture. We're also a predominantly Black neighborhood, and so mending that relationship to agriculture, that historical relationship. But then on top of all of that, in the end, they've then grown this produce locally, they've learned about it, and then we sell it to the community, but also they participate in programs where they can take it home. And so rather than it being this community garden where people volunteer their time, which would be so ideal in the nonprofit world if we could just get everybody to do what we want them to do without paying them. But that's, when it comes to valuing the input and the presence of individuals that we're wanting to support, being really mindful of that compensation that we offer in return for them, for their labor, their mental and emotional labor that they contribute to us.
Thank you, Rachel. I think that's a really important point to close us out on. Okay, Elizabeth?
All right, thank you to Richard and to our panel. And if you'd give them a hand, and as you are, we're going to bring